I hate neuroanatomy. Neuroanatomy, this tract, that tract, spinal thalamic tract, rubro this tract, dorso-rostral, scratch my shoulder by reaching through my fly tract. I don't want to memorize it, and I don't want to see silver stains, and I don't want to study Ramona Cajal. I don't want to study neuroanatomy. It's too picky, and I don't want to name it. So I have Dr. Fisher's handy-dandy special 12-minute neuroanatomy for people who want to go into orthopedics, neuroanatomy for people who hate neuroanatomy. And that is, you don't need to know the name of any tracts. So this is, what is this? Is this the spine, or is it me bending over picking up one of my pens? This is the spinal cord. This is the spinal cord. And here, let's see. What if we have the anterior spinal artery? Anterior spinal artery kills off everything except the posterior columns. Kills off everything except the posterior columns. Oh, the posterior columns. Where if you lose the posterior columns, the dorsal columns, the posterior columns, you lose the position of your vibrator. You lose position and vibratory sense. Oh. Position and vibratory sense goes in and goes up on the same side, and it crosses up in the brain, up in the midbrain. So, subacute combined degeneration of the cord, subacute combined degeneration of the cord, you lose only position and vibratory sense. B12, you lose only position and vibratory sense. Neurosyphilis, you lose only position and vibratory sense in dorsal column defects. Oh, next one. Pain and temperature. Pain and temperature. Well, pain and temperature cross at the level of the spinal cord. They cross as soon as it goes in. They cross and goes in. It goes up on the contralateral side. Goes up on the contralateral side. Pain and temperature. Pain and temperature. Oh, the next thing, let's see. Spinal trauma. Spinal trauma, when you have spinal trauma, you lose everything. Spinal trauma, you lose everything below the level at which you had the trauma. You've got some incontinence. You lose everything. You lose weakness. You got weakness, position, vibratory, incontinence, and steroids. Steroids for treatment. Now, here's the good news. Everything for diagnostic testing in the spinal cord, the answer is MRI. The answer is MRI, because for neuroanatomy, MRI. So far, have I made you learn the name of any tracts? Did I make you learn the this-o-that-o tract? No. I have not. So you don't need to know the names of the tracts for our answers on this type of exam, which is a clinical examination. Pain and temperature cross at the level of the cord and go up on the other side. Position and vibratory go up on the same side and cross later on in the midbrain. This is part of the reason that, remember we said posterior strokes can give bilateral findings? This is part of the reason that posterior strokes can give you bilateral findings. Trauma, you lose everything below the level of the trauma, and you can have incontinence, sphincter problems, and you treat with steroids. Next one. So that means pain and temperature. Look at this, pain and temperature. I'm going in, I'm crossing, and I'm going up the contralateral side. Now, what is the difference between myelia and the spinal cord and myelia in the bone marrow? Myelofibrosis is a bone marrow problem. Myelodysplasia is a bone marrow problem. Myelofibrosis, myelodysplasia, myelofibrosis are bone marrow problems. but transverse myelitis is in the spinal cord. Syringomyelia is in the spinal cord. Why are they the same name? Mostly for white matter, white matter. So what's the difference between the word syrinx and bubble? Syringomyelia and a bubble or a cavity. What's the difference between saying syrinx or syringo and bubble or cavity? And the answer is $50,000 a year on average tuition for a private American medical school, or $40,000 for a public one. So you didn't spend all this money to go to medical school just to say, yo, you got a bubble in your cord. You're going to all this expense in medical school to say syringomyelia. Syringomyelia is that you have trauma, sometimes causes it, or tumor, obstruction. Ready? Look up, look up. Here we go. And you get a bubble in your cord. And look at this bubble in the cord. This bubble in the cord is making a mistake and killing off everything in the center. Oh, what's in the center? What's in the center? What's in the center is it damaged everything in the center. Now you got a bubble in the cord. And what did I do? I ripped through your pain and temperature fibers. I ripped through your pain and temperature fibers so you have bilateral loss of pain and temperature. Bilateral loss of pain and temperature. That's syringomyelia, MRI, and surgical repair. MRI, surgical repair. Why is it across the arms? Cape-like distribution, as if anybody's wearing a cape across the arms. Because the spinal cord up in the thoracic and cervical region is wider. There's more room in it. You can put a bubble in it. You can put a space in it. You actually can put a space in there. The spinal cord down lower in the lumbar region is more narrow. You're getting down to the conus medullaris. The thoracic area is more narrow too, and also the thoracic spine is virtually immobile. So syringomyelia is a bilateral, cape-like distribution, loss of pain and temperature. MRI, surgical fix. Syringomyelia. Next, you cut both of these. Very popular in Napoleonic Wars. You get bayoneted in the spine, and you lose ipsilateral position and vibratory sense, and contralateral pain and temperature. Ipsilateral, contralateral, ipsi-contra, 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 ipsi-contra. Brown Sicard, being cut in the spine, knifed in the back, bayoneted in the back. The very, as I said, Napoleonic War. Do you hear the people sing? It is the song of Brown Sicard. It is the music of a people who will not be slaves again. So there it is, ipsilateral and contralateral. And most of it's from injury that you can't do anything about. A small number of them from a cancer that is compressing. And if it's a small number that is a cancer that's compressing, you can decompress the spine and it'll come back partly to life, maybe. Last one, anterior spinal. If anterior spinal infarction, if subacute combined degeneration of the cord is you lose only position and vibratory sense, B12 syphilis, if subacute combined degeneration of the cord is you lose only position and vibratory sense, it means that anterior spinal artery infarction is you retain only position and vibratory sense. You retain only position and vibratory sense. If subacute combined degeneration of the cord is you lose only the dorsal column, you lose only position and vibratory sense, that means anterior spinal artery is you retain only and everything else is dead. You lose motor, you lose pain, you lose temperature, you lose a lot of sensation by killing off the anterior spinal artery, and you can't do anything about it. Welcome to Dr. Fisher's handy dandy 10-minute neuroanatomy and functional disease section, and that's all you need to know.